Hi, this video is a testimony and it's a 9 month follow-up. And before Tommy share his experience with the audience, I'm gonna show the audience what Tommy used to look like before, and he had a pretty significant thinning and balding in the frontal area, and we just rebuilt his hairline and brought everything back to him. And we lowered hairline, filling the frontal, and brought in his both temple as well. And that's before and a year later. See how much younger he looked. Before and a year later. Right hand side, left hand side. You see he's putting his ball in Brian's temple. And Brian's temple as well. And the top view. And the top view. And that's before. Okay, so now. Alright, so Tommy, why don't you start let's share an experience how you found me and what's the decision to choose my clinic and the experience on surgery day.
Well, about 10 years ago I started noticing receding hairline, and maybe 3 years ago it started to affect me, and when I would look in the mirror I didn't like what I saw. So I started doing some research, and I spent about 2 years checking out different doctors, clinics, and I thought I had made the decision to go out of state to a doctor in that state. And 2 years into my research, I was on the internet one day and I decided to check again. And I came across Dr. Diep's website, and I started checking out some videos he had, and I was extremely impressed by his results. And being a little bit skeptical, I said, well, let me go down and check him out. So I came down and checked him out, and I left even more confident leaving his office. He explained to me that he could guarantee good density. I explained what I wanted as regards to hairline, and I went with the decision to go with Dr. Diep. Surgery day for me was a breeze. I came down, I was more excited than nervous.
Great.
And I remember very little about it because I slept through most of the procedure. It was so relaxing. I've had more dental visits that gave me more pain, because I had no pain on surgery day. They woke me up for lunch. After lunch I dozed back to sleep again, and they woke me up to tell me it was all over. I had no pain, no discomfort. I came down the next day and they done a thorough washing of the scalp.
Great.
And that was probably my biggest fear, that I washing my hair, that I would knock out grafts, but that didn't happen. 3-4 days later I had a little bit of swelling, not much, but that went away after 4 days. I went on a road trip. It was a week on the road and washed my hair every day, and came back after, I think it was 10 days, had the sutures removed, and was very, very happy with the result. I had very little shedding of the grafts.
So it's pretty rare. I mean,
Yeah,
normally
yeah.
people will be shed everything.
I was expecting it to all fall out, but
Yeah.
no, I'd say I held on to 3/4 of them.
Great.
At least. And maybe in the end of the second month into the third month I noticed the hair growing. And in the 4th or 5th month I was just blown away by how much hair. Then a couple of more months later on, I see the density, and I wasn't even expecting half of the density I have. I can run my hands through it, and it looks great. The transition from my own hair into the new hair is perfect. I like the hairline, I like what he done, and I would highly recommend checking him out, because I was just absolutely blown away.
Yeah.
An excellent surgeon.
Thank you. You mentioned about you look in the mirror.
Yeah. After I got my hair cut, I went home and had a shower, jumped out of the shower and went to comb my hair, and wow, there's the guy I remember. And it took me back to my mid-30s.
Great.
And except for the grey hair, it's everything looks similar to what I had in my mid-30s.
Yeah. Well, I can't help you with the gray hair. However, you can do a little dyeing and all this stuff. And
no, I'm comfortable with the gray hair.
But you know, I can create a hairline, really custom hairline for all individual personality, really. And for Tommy, he's not the type who want an aggressive hairline. And you see some of a couple of my clients who was even 80 years old. One of them, he want Elvis hairline, so he wanted more aggressive, and we can do that as long as proportional to the face. And Tommy here, he wanted natural for him. That is what he was before, and so we created a mature hairline for him that he walked down the street, no one knows he have had any.
And when I meet people now, before I would see their eyes go to the top of my head and be looking at my bald forehead, but now when I meet people for the first time, they don't even go up to my hairline. They make eye contact. I can tell that they don't even know I've had a transplant.
And that's a great part.
Yeah, and I have some co-workers who knew I was coming in to have it done, and when I got my hair cut and I arrived in, they're like, wow. even my girlfriend, she when I got the haircut and arrived home, she's like, damn, that's amazing.
Thanks.
So,
and again, in many of my videos, as I mentioned, as long as you do it proportional, vertically and horizontally, over your face, it actually take the attention away from the hairline. Yeah. Because when you lose the hair and you have a bigger forehead and the hairline's high, all the attention is to the forehead, right? Yeah. And that's why people notice when they talk to you, their eye drift off to look at your hairline before, right?
One of the things, you know, I can come in here and tell you what I want and explain it to you the best I can, but to actually walk out and a couple of months later seeing exactly what you want, and it's not something, oh, he didn't do this or he didn't do that, but you nailed it. It was absolutely perfect. Yeah. It's exactly what I wanted.
Yeah, thank you. And again, for my work, it's not just the surgical skill when I focus. That's will give you the density. But I focus heavily on the artistry of the hairline, and to make sure that we cater the hairline according to individual facial structures. But a lot of time we take in consideration what the patient wants, and whether they want aggressive hairline or mature hairline and those stuff. And when we add them all together, and the more a patient put input into the hairline, the more I found out that they're more satisfied with the hairline and with the result. Again, I focus heavily on the artistry of the hairline. You need not just a surgeon, it's an artist as well. And that's what separates my work from a lot of places. And look at Tommy right now, he looks so much younger. I would say 39 years old.
Well, for me, you nailed it. So,
well, thank you. Thank you for the honor to pay attention and do a follow-up, and thank you, Tommy, for showing the full face. And it takes a lot of courage, but at least that will help the audience to know that their hair transplant is real. There are one surgeon to another is different, and
very much.
You just gotta do your research.
Well, I would never hesitate coming back here again.
All right, thank you.